All right, I'm Dr. Vincent again, talking about low-dose immunotherapy. In this video, let's talk about the things that we can treat with LDI. And there are a lot. So allergies is kind of a basic category that people can conceptualize, like, oh, if I eat chicken, my mouth itches, I get a stomach ache, or if you eat a peanut, you get hives. So any kind of allergy reaction like that seems to be very obvious. The exposure elicits the same kind of reaction every time you're exposed. That's what a true allergy looks like. You can have environmental allergies to dust, pollen, grass, animals, mites that live on your skin, mold. We have all those things in the environmental mixture. In the food mixture, we have a couple hundred different foods, but because of cross-reactivity, it tends to cover virtually anything that humans eat, with rare exception. We have a chemical mixture for people that have chemical sensitivities or chemical allergies. It does not cover drugs like pharmaceuticals, but we can desensitize people to those individually if you have a drug allergy. All you have to do is have a sample of the drug and dilute it, and you can find the treatment dose for whomever. Other things people react to in the allergy realm include essential oils. I have people that are allergic to certain flower essence oils or citrus oil or oregano oil or whatever. We have a mixture of those things. We have artificial colors. We have gluten by itself. So people that have celiac disease, we can treat extremely effectively. The older therapies like LDA, EPD had no success treating people with celiac disease because for some reason using a whole grain source for the antigen did not work. But I figured out years ago that we can use gluten as an isolated antigen and we can completely solve celiac disease. In the category of autoimmunity, as long as we know what the triggering antigen is for somebody's autoimmune disorder, we have a way of treating it. And I have, over the last 15 years, since 2009, identified a lot of antigens that cover different specific autoimmune disorders. Like psoriasis, for example, I put together a mixture of skin fungi that works the vast majority of the time for plaque psoriasis. Sometimes it's a food allergy, sometimes those people react to strep. So there's diversity in what kind of antigens trigger different autoimmune disorders. Crohn's disease, ulcerative colitis, the inflammatory bowel category. There are a number of gut organisms that can set those off, and we have different mixtures for that. Rheumatoid arthritis, ankylosing spondylitis, other kinds of inflammatory arthritis, we have antigens for all of those things. Even osteoarthritis, what everybody always thought was wear and tear and age related, we can fix that for the vast majority of people using an LDI mixture made of collagen molecules. Just about any autoimmune disorder you can think of, we have something that might work for it. A very broad armamentarium. Outside of the world of autoimmune diseases, we have some chronic inflammatory conditions that we have good success with too, like Lyme disease, for example. So chronic Lyme disease responds extremely well to LDI. We're using a mixture of the bacteria that we find responsible for those conditions. So Borrelia, Bartonella, Babesia, that category. People that are suffering from those chronic inflammatory conditions, we can turn them off like a switch when we get the dose right, in most cases. Things that people thought were always chronic infections, some of them respond really well to LDI too, like acne, cold sores, genital herpes, hidradenitis suppurativa, other like recurring staph infections in the skin. A lot of these things resolve with LDI, which shows you that they aren't truly infections. What they are is the immune system reacting to an organism, which is a little different. And so in the 15 years I've been working with this, I've gotten really good at identifying which things we should be able to treat, figuring out antigens to treat new disorders along the way, and just about anything that seems to have some immunological component to it, we seem to have an approach to treat with LDI. So if you're not sure, just email us and ask, hey, I have this condition, do you think it's treatable with LDI? And we'll let you know if we've had success with it, or if we've never treated it before, I'll let you know if I think it's feasible, something worth trying or not.